Yeah. Okay, just I'll hand you this. Jazakallah khair, Dr.
Do you want to make the OBS smaller because it's cutting out the two sides? In OBS.
No, OBS shows all of it.
Is that right?
It shows, yeah. You go to slideshow and you do. Yeah, so it's a bit still.
It's showing the same as it's showing on the screen.
So this is what you will see, the other one will be.
It shows exactly the same as you can see.
It's fine though.
Yeah,
it's fine.
Yeah.
Now. He's sorted it out.
Yeah, that's what it shows.
That's fine now.
Yeah, so that will be. So Dr. Shazia Shabir, mashallah, she's consultant physician in the Queen Elizabeth Hospital, yeah, mashallah, and she's going to teach us about things about we have to be mindful of in Ramadan, inshallah. So Dr. Shazia.
Assalamu alaikum. I don't feel I'm learned enough to be sitting in Dr. Ghannam's seat, but I'm very grateful for the opportunity to talk. For those that don't know me, my name is Shazia Shabir. I'm a consultant in kidney medicine and kidney transplantation at Queen Elizabeth Hospital in Birmingham. And over the next 30 minutes, I'm just going to touch on a lot of aspects that we all are very familiar with regards to Ramadan, and then more specifically look at certain chronic conditions that can be adversely affected by fasting, and how does one optimize their health with those conditions if you wish to fast. Okay, so we're on the eve of Ramadan starting. We're about a week away, and as usual, these are going to be long fasts. We will be entering into summertime over this weekend, and the fasting will get progressively longer as the month progresses. And it's important that we balance food and fluid intake between the fasts to prevent muscle breakdown and dehydration. And to be able to maintain our body weight, our energy intake must equal our energy expenditure. So if all that we're wanting to do is eat and sleep, then there isn't much calories that we need, because we won't be burning very much. But if you have an active lifestyle which is not going to change significantly during the month of Ramadan, because you're still going to be working at full intensity, undertaking physical activities, be that sport, or other things, then it's important that with the reduction to 2 meals during the month of Ramadan, you ensure that you are matching your calorie intake with how much you're going to be burning. Otherwise you will lose weight, and if that's not your intention, then a balance is required. Okay. So as I've said earlier, the aims is to understand our normal body functions, and then with that understanding to allow us to prepare sensibly for Ramadan. Some practical tips with regards to food, drink and sleep, and then touching on illness and fasting, who should and who shouldn't fast during Ramadan. Okay, So in the normal physiology of the body is such that we require energy from sugar and fat. The average man requires between 2,000 to 2,500 calories. This is not a hard and fast rule. If you have a predominantly sedentary lifestyle, then you require less calories. If you have an exceptionally active lifestyle, you require more calories. And the average woman will require between 1,500 to 2,000 calories in a given day. Just to give an indication of where our calories are coming from, a gram of fat will provide 9 calories, a gram of carbohydrate provides about 4 calories, and a gram of protein provides 4 calories as well. And remember that if we're consuming a lot of calories and we're not burning that many calories, all the unused calories will be stored as fat in our body. Okay. The other physiological functions of the body is to produce urine, and the purpose of fluid loss from the body is to maintain a fluid balance. If I decide tomorrow to drink 5 gallons of water, then my kidneys will pass out most of that water and only retain in my body how much is needed by for my body functions. Now, if my kidneys don't work, then I will run into great difficulties, because if I drink 5 gallons of water, there will be 5 gallons of water sitting in my body, and that will go to my lungs and cause difficulty with breathing. So the body is, mashallah, designed in a very intelligent way that allows balance. So the fluid that we drink, any excess that we don't need, is lost through urine, feces, sweat, and breathing. Our kidneys will produce 1 ml of urine for every kilogram in body weight per hour. The average adult male is 70 kilograms, so the kidneys will produce 70 ml of urine per hour. So in a given day, the kidneys are producing just over 1.5 liters of urine. We also lose fluid through feces, sweat, and breathing, and that amounts to about 1 liter as well. So all in all, we're losing 2.5 liters of fluid in any given day, and therefore it's important that we're drinking about 2.5 liters of fluid in order to maintain a good hydration status. Now, the final sentence I've kept in, I'm grateful to some of my colleagues who've lent me their slides, and I found this one amusing, which said salt is shaitan. As kidney specialists, we have a particular detest of salt, but this slide was in fact from a diabetes specialist, so it's good that we're sharing that dislike. And it's a constant battle at home, with Waqas and Yusuf happily sprinkling salt on everything, including fruit, and me sitting there grimacing at them every day. Okay, so why is salt such a bad thing? The body needs a small amount of salt, but it is a very small amount of salt that's needed by the body, and that's because the kidneys use the sodium in the salt to maintain the correct fluid balance. So the amount of salt that's needed for any one of us is only a level teaspoon a day, and that's all our salt intake. So we've got to remember that we're not putting a teaspoon of salt into the food that we're cooking. It's actually all the food that we're consuming. That should be the total salt consumption. So there isn't very much salt that should be added to the food, if any, because you're already going to be exceeding your daily requirements. Now, needless to say that most people are consuming too much salt, probably double the recommended amount. And high salt consumption is associated with increase in blood pressure, with increase in heart disease, with increased risk of stroke, and with also an increased risk of vascular dementia. So there are real significant health consequences related to high salt intake. And the World Health Organization has long made a target globally to help the population at large become aware of the dangers of salt, and to form strategies by which to reduce salt consumption. And it's postulated that an estimated 2.5 million deaths could be prevented each year if we just reduce our salt consumption to the recommended amount. And the recommended amount for children is much less than for adults, and that's because the children's kidneys are still developing and wouldn't be able to cope with a teaspoon of salt. So how can we reduce salt consumption? Firstly, it's by not adding salt to food that we're cooking, and that's because 3/4 of the salt that we eat daily is already added to the food before we buy it. It's important to choose products with a lower sodium content, and sodium, we have to remember, is found naturally in many foods that we are consuming, such as milk, meat, shellfish. And there's also high amounts of salt in processed foods such as breads, processed meat, cheese, ready-made meals, instant noodles, breakfast cereals, canned soups, pastries, pizzas, biscuits, cookies, which you wouldn't think have salt, but they do. We don't taste it because of the sugar content in the cookies, and the same applies to cakes and sauces as well. Ketchup, again, you wouldn't think there's salt in ketchup, but there is, and we don't taste it because of the sweet taste of ketchup. There's salt in gravy, mustard, brown sauce, soy and fish sauce, so lots of salt. And salt will drive thirst. So if you're going to be eating these kind of foods during Ramadan, then we have long periods without being able to drink, we will get very thirsty. Okay, now we come on to what should we eat. And before we start thinking about what we should eat during Ramadan, it's important to actually focus on what we should be eating on a day-to-day basis for to be able to be in the best of health. And if I was to tell you that the extensive scientific research has identified a diet which is considered to be one of the healthiest diets on the planet, would you be interested in knowing what it is? Especially if that scientific research has shown that this diet helps prevent and reduce risk of heart disease, stroke, cancer, death, and these are the big killers that we are dealing with. And this diet also has beneficial effects on balancing blood sugar levels and blood pressure. It reduces the risk of type 2 diabetes. It's also good for brain health, so you're less likely to develop Parkinson's disease, Alzheimer's, and depression. And there was an extensive study involving about 1.5 million people that showed that there was 9% less deaths in young people who followed this diet. So you're interested in knowing what it is? It's the Mediterranean diet. So the word diet is in fact misleading. It's not a restriction of any kind. We associate the word diet with having to either cut back on the amount of food that we're eating or have to eat in unpleasant foods in order to be healthy. But this is not the case. The Mediterranean diet is in fact a lifelong way of eating and living. And so it's a diet that's full of fiber, protein, and healthy fats. It's free from ultra processed foods, and these are the snacks that we buy in the supermarkets, the ready-made meals, the processed meats, sweets, soft drinks, breakfast cereals. So the Mediterranean diet is free from all of these things. The meals in the Mediterranean diet are built around vegetables, beans, and whole grains. It advocates eating healthy fats through fish, at least twice a week, and fatty fish such as salmon, tuna, sardines, anchovies, mackerel, and herring contain high amounts of omega-3 fats, and omega-3 fats have been shown to reduce inflammation, reduce bad cholesterol, and then in turn reduce the risk of heart disease and stroke. So lots of benefit from this. The Mediterranean diet also uses olive oil as the main fat for preparing food, although you could substitute olive oil for other plant-based oils as well, such as rapeseed oil. It advocates having dairy and eggs and poultry in moderation, so maybe eggs probably about 2 to 3 times a week, and having red meats and sweets occasionally. Desserts is not really a feature of the Mediterranean diet. uses fresh fruit for dessert. You could substitute that with dried fruit or homemade sweets using honey. Okay, so now we come on to the Ramadan diet. So the Ramadan diet should really be not very different to our day-to-day diet. It should be simple, and it should be one that allows us to really eat foods that will give us energy through the long fasting period, that won't give big spikes in sugar levels and then causes hunger pains. As we're going to be eating one less meal during Ramadan, the diet needs to be sufficiently balanced so that it keeps us healthy and active during the month. Eating complex carbs, the picture shows, will ensure that energy is being released slowly through the long periods of fasting. And these are things like grains and seeds like barley, wheat, oats, semolina beans, whole flour and basmati rice. Fiber-rich foods are also really good to have during Ramadan as well. They're digested slowly and will release energy through the day, and these include whole wheat, grain, seeds, potatoes with skin, vegetables such as green beans, all fruit that's eaten as whole. So I know that, over the past many years there's a real trend to blitz fruit in a blender or have it as a smoothie, but in fact there's a lot of benefit in eating fruit as God has created it, eating it whole. Okay, so at Suhoor time, having slow digesting and energy rich foods such as porridge, muesli, bran, barley, wheat, semolina, beans, lentils, which we call dal in the South Asian world, eggs, chicken, fish, broccoli, wholemeal bread, roti, brown rice are all very good. Well, you can pick and choose. You've got 30 days to be able to spread them out. That's right. No, not all of them in one go. And these foods will help help avoid you feeling bloated and tired. They will provide you with enough energy for the long fasting period. It's important also to have good hydration as well, because if you drink plenty of water, that will aid digestion, reduce headaches and dizziness. It's as much as we like sugary and fizzy drinks, but they're not good for hydration. And also it's important to avoid high caffeine drinks as well, as they cause you to lose more fluid. And as by the Sunnah, we are advised to take suhoor as late as possible. I mean, having a suhoor late as possible is something that have struggled with over the past few years when Ramadan has entered the summer period, and that's because I've had to make a decision on what's safe for me as a hospital doctor, dealing with emergency admissions or patients coming for kidney transplants, where sometimes made with regards to life and death, and looking after people who've just come out of theatre as well. If my focus is sharp as it should be, then there's a real risk of harm to the patient as well. So I've made the concerted decision that I was going to take my suhoor as early as I could to allow myself to have block sleep so that I could be safe at work when dealing with patients. And I think these are the modern day problems when you're living in a non-Muslim country where the Ramadan day is not shortened for us. And I think each and one of us have to make those decisions depending on what our circumstances are. With regards to iftar, so the healthy break fast is to have water, which is energy. Drink as much water as possible during the sunset hours to replace dehydration from fasting. Cut out fried foods and try grilled, baked, steamed or shallow foods. Foods, tasty as they are, will cause indigestion, heartburn, weight gain and make you feel bloated. Try to have a light meal consisting of fruit and vegetables such as olives, onions, cucumber, figs, dates, grapes, as well as pulses. Okay, so couple of fun things. Did you know that the act of eating actually causes you to feel full? One apple has 53 calories, but if you had a glass of unsweetened apple juice, that has 125 calories. So we come back to the Mediterranean diet, where we advocate having wholesome food, so eating food as it is produced rather than mixing it to a pulp. And if you ask yourself what you feel fuller, drinking a glass of apple juice or eating a whole apple, I think for most of us, we believe that a whole apple will make us feel fuller, and it also, like myself who have a sweet tooth, this is just a reminder that it is just fried sugar syrup. And then, you know, grilling will cause meat or chicken to lose fat, whereas frying does the opposite. So this is just a little summary of the foods to avoid during iftar. The deep fried foods like pakoras, samosas, fried dumplings, the high sugar, high fat foods such as the Indian sweets, the gulab jamun, the rasgulla, baklava, and then the high fat foods such as the parathas, which are fried chapatis, oily curries, greasy pastries, and then the cooking methods to avoid, which is deep frying, and curries with excessive oil. And there's an alternative, very long list of the healthy alternatives for Ramadan, after Ramadan, for day-to-day life, in fact. And it's important not to forget that we need our sleep, and whilst we're sleeping, less energy is being used. It's estimated that adults should have about 7 to 9 hours of sleep daily, but everybody is different. Sleep, then that is associated with increased hunger, craving for junk food, and weight gain as well. And then during Ramadan, we've got such an altered schedule, both in eating and sleeping, that there are lots of traps that we could fall into that we're ill. So it's really important that we try and have naps when we can, just to bring our energy levels up and just remain functional as well. Okay, so the kind of common difficulties we can run into with fasting: indigestion, and you control heartburn, the belching by eating in moderation and avoiding oily food and the very spicy foods. We can also reduce indigestion by cutting back on caffeine intake, and so if they stop smoking, then that would be a benefit. Headaches are related to dehydration, so not drinking enough fluids or lack of fluid. Sleep. And we come on to dehydration as well, which is very common during a fasting state. Remember, the body continues to lose water and salt through breathing, sweating, and urination, and the risk of dehydration is higher in the elderly and in also people who are taking tablets such as diuretics. So that's furosemide, benzoyl if they're on these for blood pressure or heart treatment. And the symptoms of dehydration would be that you generally feel run down, you may be experiencing muscle cramps, dizziness, disorientation, or you may feel faint or collapse. If not drinking enough fluid, then there's an increase of constipation as well. Okay. Having said that, there are lots of benefits of fasting, so that I remember when I used to mention fasting to non-Muslim friends, there used to be a shock response, which is, oh my goodness, how are you going to survive? You'll starve. Of course, fasting is very different to starvation. Fasting is about time-restricted eating, and now over the years, Dr. Mosley's 5-2 diet has become very popular. Everyone seems to be taking 5-2 diet. And of course, Muhammad Sallallahu Alaihi Wasallam, we know, fasted for 2 days of the week. So the reason why fasting has become such a fashionable thing to do is because there are a lot of health benefits associated with fasting, and that is that you can obtain weight loss, improve your risk of metabolic syndrome, or if you have gotten the metabolic syndrome, then you can improve your regards to that. Because fasting through cholesterol, it helps control blood pressure. It also helps control glucose as well, and your risk of diabetes. Or if you have diabetes, you can reverse that risk by losing weight. It's good for your mental health as well, and if you have got addiction to smoking, help you kick the habit. Okay. But it's also important to remember that although fasting is a fard, it is not safe for everybody, and Allah has given us laxity with regards to fasting if it is going to be detrimental to our health. So it's important that if you have any valid exemption not to fast, that you do not undertake the fasting if it is detrimental to your health. And by doing so, you may be committing a sin. We should not contribute to our own destruction. Our body has over us. Okay, so who are the people who are at risk of from fasting? It's not listed. There's quite a list, and I've just put the more common things here. But people who've got pre-existing health conditions such as diabetes, chronic kidney disease, transplant patients, so that could be kidney transplant, paratransplant, well transplant, heart transplant, lung transplant patients, stem cell transplant patients, or individuals who are taking their medications, they have autoimmune conditions, And all of these conditions can be made a lot worse through the fasting state. Epilepsy, Parkinson's disease, and I'll come back to those. If somebody has an acute infection as well, they need to take regular antibiotics 3 or 4 times during the day. Then the fasting state will not lend to that. And of course, pregnancy. Okay, so if individuals do have a chronic health condition that requires monitoring, treatment, and wanting to fast Ramadan, then it's important that they schedule a visit with their doctor specialist at least 2 to 6 months before Ramadan. And the purpose of this is that they can do with regards to their risk for fasting, and that involves the doctor taking a detailed medical history, including what changes happened since the previous Ramadan, what illnesses have been fasting previously, and take into consideration their work, lifestyle, and family aspects as well. Driving is important. People that have your ability to hold a driving license, and so if you're a diabetic on insulin, then there's implications for driving. Or if you're a diabetic taking medication, where there will be an risk of blood sugars, implications for driving license. And so if your specialist is telling you that the risk of having hypoglycemia with fasting is high and you shouldn't fast, and that you're going to go ahead and fast, that has legal implications. Because if you're then driving, have a hypoglycemic episode, you can have an accident, you can harm other people. So you do need to then be up to the specialist and let them know that you're intending to fast against medical advice and inform the DVLA. And if you're not informed the DVLA, it's going to inform the DVLA with regards to that. There's also assessments that can be done ahead of Ramadan, so it is possible to do some trial fasts, and usually we advocate those to be done a month before Ramadan, because it's a similar kind of length of day between sunset and sunrise, and maybe asked to do 5 fasts and do those fasts. And you're more likely to feel comfortable breaking a fast during the trial fast during Ramadan, or more reluctant to break a fast during Ramadan. Fast would be useful. I think maybe you're advised to fast later in the year when it's winter time and the fasting period is shorter and it has less adverse implications to your health. We can obtain some advice from the dietitians with regards to fluids and meal planning, advice on exercise. There may be medication adjustments that are required, and I'll come back to that as well. And if you fall into the very high risk would be advised to fast. If you're moderate to low group, then be given the right to fast. So we on to diabetes. There are lots of factors to consider when deciding if a diabetic is safe to fast. The type of diabetes is important, whether they're type 1 diabetic, so they'll be on insulin right from the start. Usually type 1 diabetics have a higher risk with fasting, and they're generally not to fast. And it's important to take into consideration what treatments the individuals are on. So if they're taking metformin is not hypoglycemia, and so that's other diabetic medications that have a higher risk of hypoglycemia, and it may be that the specialist will need to change those if it's safe to do so before you undertake fasting. It's also the specialist will have to take into consideration if you've had any admissions with diabetic coma, if you've had severe hypoglycemic episodes in the preceding 6 months before fasting, especially 3 months before fasting, and that's a no-no then for your safety to fast. If you've got systemic disease such as heart disease, heart failure, kidney disease, that increases your risk of undertaking fasting. But everybody's different, and that's why it's important to have a discussion, a consultation discussion with your specialist. High blood pressure and heart disease. Generally, people with high blood pressure are able to fast, but there are considerations. If you're on medication that is a diuretic for your blood pressure, so those are water tablets that will increase your tendency to pass urine and lose fluid, then they can increase your risk of developing acute kidney injury with fasting because of the prolonged periods without fluid. So some tablet changes may be necessary for it to be safe for you to fast, and again that's what the doctor. Now we come on to patients who have chronic disease, or patients who are on dialysis because they have end-stage kidney disease, or people who have a kidney transplant. The kidneys are really important for balancing fluid and stopping the blood from clearing waste. Kidney disease varies in severity, so we have stages 1 to 5, and as you go into stage 4 and stage 5, that's severe kidney disease. In general, as a rule of thumb, people who have stage 4 and stage 5 disease are not safe to fast. Who are on dialysis generally are not safe to fast. Individuals who have a kidney transplant, generally we advise them not to fast as well. There are in that people who have a kidney transplant who have excellent and stable transplant function may be safe to fast. However, they are most likely to be on anti-rejection medications with apart, and the interval between sunset and sunrise is not long enough to be able to trial between their morning medications and evening medications. And if you start taking the immunosuppressive medications together, then there's a transplant specialist at least 3 to 6 months before Ramadan, and discuss their intention to fast. And it is possible to switch them over to once-day immunosuppressive medication. But when we're switching the anti-rejection medications, the switching period in itself increases rejection slightly, and that's why it's important that it's done in a timely manner. They have to have monitoring for at least 3 months to ensure that the kidney transplant function is stable before they're given the thumbs up to be classed. Peritoneal dialysis. I have had a couple of patients who are on hemodialysis that have fasted and have been okay. We don't really advise that they don't fast on the day of dialysis, and that's because the hemodialysis process is 4 hours. They're connected to a machine that's taking a lot of blood out of their body. If they're fasting all day, then their risk of dropping the blood pressure on that during the dialysis process is increased, and that increases their risk of having a cardiac arrest. So we advise that they fast on non-dialysis days. People who are on peritoneal dialysis in itself invalidates the fast, because you're putting a bag of sugar solution into the peritoneal cavity, and therefore fasting is just avoid all that. So people who have anesthesia, they're reliant on taking medication at a fixed time, and if they wanted to take up fasting, it's really important for them to see their neurologist to be able to determine whether times can be adjusted to keep their epilepsy stable, and for them to take fasting. But separation, hunger, and thirst can precipitate a fit, so that makes it really challenging despite the medication changes. And there are many fits before they're able to get their driving license. And they go to then take up fasting against medical advice. Once again, there's implications to their driving license, because if they had a seizure whilst they were driving against that, and they just want to use as well. The important thing is to remember that if you become well, you can and you should break your fast. There is no sin or penalty associated with this. And if you don't break your fast, you may cause harm. You may lose more days during the month of Ramadan. You may kill yourself continuing to do so. Okay, final words. Smokers, pakora, they have their appeal, but limit intake and frequency. Ramadan is not 30 days of fasting and 30 nights of feasting. The